Hello, hello, hello. Welcome, welcome, welcome. Come in, come in, come in. This is Tamika's Den. I am Tamika, and this is Self-Care Saturday, y'all. So get on in here, all right? If you are new to my channel, welcome, welcome to you. And today, you guys, I'm going to be focusing on mental health awareness because May is Mental Health Awareness Month, all right? I have been focusing on mental health all this month. And being as though this is the last weekend, okay, of May, I'm going to focus on it today. Now, of course, this won't be the last time that I'll ever talk about mental health because I usually, talk about it whenever I can, all right? I always want to shine a light, stop the stigma, break the silence, and all of that good stuff, right? Sometimes I give self-care tips. Sometimes I'm doing positive affirmations. Sometimes I'm just doing some check-ins, letting y'all know I'm still here. If you still here, we still here. Go us, because some did not make it. And I am most definitely always trying to bring awareness to mental health. So having said that, let's go ahead and get into it. Now today, you guys, I just want to talk a little bit about, we've had a lot going on, right? It's been sickness. It's been the pandemic. It's been news of death every time you turn around. It's been jobs being lost, financial problems, right? We had the mass shootings. We had the subway, violence in the subway here in New York City. The violence has been going up, period, in New York. We have attack on human rights, racism, hate, overdoses on the rise, and untreated mental illness on the rise, you guys. And so with mental health, okay, let me say first and foremost, protect your mental health, you guys. Protect it, all right? When I talk about self-care, it's not an either-or thing, all right? Self-care is an umbrella that has many things underneath it. Mental health is an umbrella that has many things underneath it, just like physical health has many things underneath it, all right? And so when we talk about self-care, we talk about what is the main thing that you need to focus on right now. What is the thing that you feel like you need self-care for the most, right? Is it your physical? Is it your spiritual? Is it your mental, right? That's why sometimes we say mind, body, and soul, okay? We have to take care of all of them. We have to treat all of them as if they are equally important, because they are. All right. And when I talk about mental health, I don't mean mental illness. Because you are taking care of your mental health, that does not mean you're mentally ill. Those are two different things, you guys. And mental illness has many different types underneath that umbrella. That does not mean one thing either, right? So we have to stop the confusion on that, right? And it also comes in different types, just like physical ones do, right? Just like if you are diagnosed, God forbid, with an illness or disease, and there are different types and different stages of that, is the same thing when we are talking about mental illness, right? That is also can be mild, severe, moderate, and it also can be a short-term or long-term thing, okay? And because we have had so much stuff going on, I saw a tweet a couple days ago where a psychiatrist says she was feeling so overwhelmed that being a therapist right now was very difficult, because she felt like she was handing sunscreen to patients that were on fire, okay? So just think about that for a minute, and know that your therapist or counselor or psychiatrist is also seeing a therapist, counselor, and psychiatrist, right? Because think about it. When we have friends that come and vent to us and tell us their problems, sometimes we start to feel overwhelmed, and we start to carry some of their issues with us on top of our own issues. So now if this is something that you do on a daily basis with patients, you can imagine that's pretty overwhelming, right? And by the way, I'm a strong advocate for counseling. I'm not trying to force it down nobody's throat. I get that everybody feels like they need counseling, but I think another big misconception we have with mental health is that if you say that you're feeling anything mentally, that automatically means you got to go on the psych ward. You got to take medication. No, that's not always what it is. Sometimes you can just go and see a counselor for a couple of weeks. Sometimes if they feel like you need more help, they may suggest you see them once a week, twice a week, once a month. It depends on your situation. And if you do need help, you guys, please, 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 please take it from somebody that has done counseling, whether it was just occasionally when my mom took me as a child, when I took my son when he was a child, or somebody like me that has been going the last few years that has seen such a difference since I have been in counseling, you guys. And so that's all I'm going to say on that. Like I said, I'm not here to try to force y'all, but I am going to let y'all know things that I think can help you. All right. This is all love and all positivity here. All right. No judgment zone. And so what I do want to do, because I noticed something else that we do, you guys, is we have a habit of saying, well, you don't look depressed. And I talked about this briefly before. That's not the compliment that you think it is. You cannot look at somebody and see if they are depressed, just like you can't look at a person and see the pain that they are feeling when it's physical, right? And so you telling me that I don't look depressed, that's nice and everything, but it doesn't stop me from being depressed. Another mistake that we make sometimes, and I don't think that this is like somebody trying to be mean or whatever. I more so think that it's because these are uncomfortable conversations to have, and because a lot of times they think that they're just trying to make you feel better. And maybe, like I said, you're also trying to just hurry up and get off this conversation because you don't want to be there. But people have a tendency of also saying, well, I feel depressed too. I feel sad too. And I got past it. Well, that's beautiful you got past it. But guess what? We are all not the same. We all don't have to put in the same work for ourselves. What you may have been able to do for you, or what may have worked for you, may not work for me. It may take me a little longer. It may be a little harder for me. So please take that into consideration when you are talking to people as well. And so now that I have brought that up, I want to give you guys the difference between feeling depressed and being depressed, suffering with depression, because they are not the same, okay? Feeling depressed, which is something that all of us human beings do, okay? And we're supposed to. If we're not doing that, then it might be something else wrong, all right? When you are feeling depressed, that means you are feeling sad, you are feeling blue, you are feeling down, completely normal. That is an emotional state or an emotional reaction to something, okay? Whereas suffering with depression means you have mental illness. Now, your mental illness can be a number of different things, right? That fall underneath that umbrella. And it's usually a mood disorder that changes one's thoughts or behaviors. Not the same, right? Don't sound the same. Two completely different things. We also have to look at how are we functioning? How are we coping? How are we feeling, right? Socially, occupationally, and personally. So you know how sometimes you ask somebody, how you doing? Or maybe I'm the one asking you, how you doing? 9 times out of 10, the automatic reaction to that is going to be, I'm fine. We're used to saying that, right? But sometimes we really not fine. Sometimes you might have somebody that come back and tell you, yeah, I'm not fine. I'm not okay. What the heck is so good about it? If you say, good morning, and you be like, ooh, why they coming like that? They're coming like that because they not happy, okay? Because something is going on, something is bothering them. But most times, because we're not going to sit there and name everything, especially whether it's a stranger or sometimes even with your friend, you may not feel like you want to put all your burdens on them. And so you're just like, I'm fine. But are you? Okay. So now, continuing on with sadness. Sadness usually fades, you guys, whereas depression doesn't. Okay, it does not come and go. It's always there with you. There's always a sadness inside of you. There's always an emptiness inside of you, no matter where you go. Now imagine feeling like that, right? Sadness also is usually something specific that happened to you that made you sad. Whereas depression is persistent. Sadness is clear and precise. Depression is vague and chronic, you guys, okay? Sadness is short term. So normally you'll feel sad for a certain amount of time about something that happened, and then you're able to move past it. Depression is long term, you guys, okay? And sadness can be an everyday life event depending on what happens to you in that day, right, that you experience. But depression affects your whole life. I hope you guys are, getting this now. You still with me? And so when a person suffers with depression, you could be low for so long that is more than just a funk. It's more than feeling depressed. It's more than sad, because it never leaves you. And I can't tell you what's bothering me because I myself don't know what's bothering me, right? And then if it is something that triggers me or that happens that makes me sad, then that amplifies it 10 more times, right? Because I'm already suffering with depression. That's the difference between feeling depressed and being depressed, you guys. All right. So we also have differences between anxiety attacks and panic attacks, right? And I suffer with both. And I have also felt depressed and now suffer with depression. So I can speak from both ends of this, okay? And the crazy thing about anxiety and panic attacks is that actually they have a lot in common. So it's hard sometimes to tell the difference between them, but they have to be treated completely differently, you guys, okay? A lot of people don't know this. And so some things that they share is fear, discomfort, fast heartbeat, shortness of breath, tightness in the throat, dizziness, nausea, headache, dry mouth, shaking. But then we look at anxiety by itself. It lasts longer. It has irritability. It has gradual buildup. It has worry. It has fear. And it usually lasts 30 minutes or longer. Now picture that, all right? Whereas panic attacks are usually shorter, specific symptoms, okay? But you will feel like you're getting chest pain, like you're having a heart attack, or like you're about to pass out. Now imagine that. And imagine feeling that on a regular basis and having absolutely no control over it, all right? And so this is how some people are living their lives. And sometimes you can periodically be feeling this. And we want to prevent you from getting to the point where it becomes more severe, right? We want to catch it before it gets there. And so you can have a better understanding when you hear people talking about these things, okay? And so also ways that we can reduce the stigma that's attached to mental health, okay, because we need to get rid of that, is we can encourage an equal conversation between physical and mental health, right? We can educate ourselves and others about mental health, which is what I'm trying to do. Don't label people that have mental illness, you guys. Choose empowerment over shame. Show compassion and love for each other, okay, which we definitely need more of in these times. Talk openly about mental health and be a positive and mental health role model. Okay, you guys? So that's all I got for today, all right? If today is not a better day, I hope tomorrow... And today is not a good day, I should say. I hope tomorrow is a better day, all right? Have a great Saturday and a great weekend, Take care of yourselves. Till next time, toodaloo.